Last week, Dr. Michael Ryan, he's a leader at the World Health Organization, announced that in response to the spread of this virus, authorities may have to enter people's homes and remove family members, presumably by force.
In most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner.
And let me start with, you're the Surgeon General. Give us your recommendation on face masks.
Well, it's important for America to understand that originally the CDC, the World Health Organization, and my office all recommended against the public wearing face masks because the best available evidence at the time suggested that they were not impactful in preventing you from catching a disease if you were the individual wearer and you were healthy. We always recommended that if people had symptoms that they wear a face mask to prevent spreading disease to other folks. Here's what's changed. We now know that about 25%, in some studies even more, of COVID-19 is transmitted when you are asymptomatic or pre-symptomatic. And so the CDC has now recommended that people wear cloth face coverings when they're going to be out in public and they can't be more than 6 feet away from each other. But here are the important points really quickly. Number one, you need to make sure you're not substituting social distancing with face masks, because the most important thing is still to stay away from people. Make sure if you put on a face mask, you don't touch your face and you don't and you wash your hands before you utilize it. And number three, save the medical mask for the healthcare workers. Excuse me, they need them. They absolutely need them to be able to respond. I have a video out where I made a cloth face mask out of a t-shirt.
I saw it. Yeah.
And rubber bands. Anyone can do this. We all need to do our part to get through this.
So let's look at each one of these and see how we can get this down to zero. Probably one of these numbers is going to have to get pretty near to zero. That's back from high school algebra. But let's take a look. First, we've got population. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, health care, reproductive health services, we could lower that by perhaps 10 or 15%.